Wonderful. Right, is everyone ready? All good? Great. Well, kia ora koutou, thank you all for being here today. It's a privilege to be here this morning to announce the first initiative from Budget 2026. But more importantly, we're here because of something that I know will matter to every New Zealander. Before I go any further, I want to acknowledge the families who are with us today. Everyone is here either caring for a child with a life-threatening illness or is carrying the grief of having a lost child. In particular, I want to acknowledge Kate and Grant Collins. When we first met in July last year, you were navigating the loss of your beautiful boy, Oliver. To be here with you again today and to meet your son, Theo, is a real privilege. He is clearly so deeply loved, and it means a great deal to be here with your family today. I also want to acknowledge Amanda Evans, co-founder and clinical director of Rei Kotuku, which is a Wellington-based registered charity that provides specialist palliative care to children and their families without charge across the lower North Island. Amanda, you have walked alongside every family here today and so many others during moments most of us can barely begin to comprehend. The care, the steadiness and compassion you and your team bring to these spaces matter more than words can capture. Thank you. Before becoming Minister of Health, I didn't realise that New Zealand didn't have a nationally consistent specialist palliative care service. And that is something that I've been determined to change. Because behind that gap are parents living with the knowledge that their child's life will be short. Parents who are doing everything they can to make that time as comfortable, as full and as meaningful as possible. And as a father of 4 young children, I can only begin to imagine what that must feel like. And whilst I still can't fully understand it, I do understand this. Parents shouldn't have to face it without the right support around them, and where you live should never determine the care your child receives. Each year, around 300 children in New Zealand die from life-threatening or life-limiting conditions, and up to 3,000 may need specialist palliative care support. These numbers matter, but what matters more is what sits behind them: children, families, and the time they have together. And that is what today's announcement is so important. Today, I'm incredibly pleased to announce that Budget 26 will invest $15.5 million to establish a nationally consistent specialist paediatric palliative care service with dedicated teams in both the North and South Islands. These teams will include specialist paediatric palliative care physicians, clinical nurse specialists, social workers, clinical psychologists and nurse practitioners. Importantly, one specialist paediatric palliative care registrar training position will be funded each year, helping grow the workforce for the future so more children can receive care at home in familiar surroundings alongside the people who love and care for them most. At the same time, Health New Zealand has committed funding to Rei Kotuku, a specialist paediatric palliative care service in Wellington, to continue providing care to many families, including some who are here today, while the National Specialist Service is established. This budget has required careful choices, but supporting families through some of the most challenging times they will ever face is exactly why those choices matter, because it allows us to invest in care that is not just effective, but compassionate and meaningful. I want to thank my Cabinet colleagues and in particular the Prime Minister and the Minister of Finance for their support of this investment, and to everyone working in specialist palliative care, to the family and friends who stand beside those in need, thank you for the care you give, the strength you share, and for helping carry something no family should ever have to carry alone. Once again, I want to say it has been an immense privilege to announce the first initiative of Budget 26 to be with these families today. And before I take questions, I want to hand to Amanda to say a few words.
Thank you. So today is about the families who are standing with me. These are families who have loved and are currently loving children who are going through the hardest moments imaginable. And many of them today have courageously stood up publicly and shared their story of their children. And they've done so children in the future can have a better experience than some of them did. Until now, whether a child received specialist paediatric palliative care was often dependent on where they lived. And that has never felt okay to us as clinicians, and it's not felt okay for the families. So today is incredibly significant. I want to thank Minister Brown for listening. Minister Brown came and met some of our bereaved families and also a palliative child in their home to actually learn firsthand what their experience is. And today's announcement really reflects the importance of getting it right for these children and family at the greatest need. And it was incredible for them to actually feel heard for the first time. We only die once, and watching your child die is something that we would never want to wish on anyone. So this is actually really high stakes business. I want to also thank Health New Zealand for recognising that these children and their families matter. We really appreciate that. So Reiko Tuku, as the Minister said, was commenced in June 2023, and we have cared for unborn babies, we've cared for teenagers over that time and supported 62 children who have been at end of life. And these are children who have mostly died at home, surrounded by their family and their toys. These moments stay with you forever, and seeing our families today, here beside me, is a real credit to our relationship. And for our future children and their families, firstly, I'm just so sorry that you need to know that palliative care exists in the first place. But I can promise you this: we will ensure that this means that you will not have to go through this alone. You will have access to a specialist team now who will work alongside your local team. And it's because of today that we can enable that. So thank you so much.
Thank you so much, Amanda. Thank you. Wonderful. So thank you so much. I'm very happy to take questions.
So there's currently one of these competing interests for the government's budget.
Yes.
Especially in health.
Yes.
How did you come to this decision? And why did this stand out to you about every other opportunity?
Well, I think when it comes to our children, I think every New Zealander would say that we need to provide compassion to those who need it the most. As I said at the start, it was something which, when I first became the Minister, surprised that we didn't have a national palliative care service for our children. And having met some of these families and hearing their stories and the challenges they've faced, it became really apparent to me that this is a real important priority. Of course, alongside many other priorities, health is going to be a huge part of this year's budget. It's a big part of this government's agenda, but today is really about meeting a need that hasn't been met and working with people who are, such as Amanda, has been a really big part of getting us to this point.
There's currently one of these positions currently funded. How many will be funded once this money is fully implemented, and where are they going to be?
Yeah, so the Health New Zealand will be working through an implementation plan to establish the services in the North Island and the South Island, and also working with Reiko Tuku, who play a really important role. There'll be additional specialists who will be employed, as well as nurse practitioners, clinical psychologists and nurses as part of these teams. And part of their role will be actually to travel the entire country and work with general practice, with hospice, with other services who provide care in the community to upskill and provide support on the ground. So one team will be based in the North Island, one in the South, but actually they will be travelling the entire country, playing a really important role to ensure that all New Zealanders, no matter where they live, are getting access to this care in their own homes, surrounded by their family and friends, so that they can receive the care that they need.
Is there any idea on numbers?
In terms of the total number, that will be worked through as part of the implementation plan. But I imagine there'll be a significant increase in number. I think there's one funded specialist position. There'll be a significant increase. There'll be several more physicians employed. But it's not just the specialist paediatric care physicians. There'll also be the nurse practitioners, the nurses, the psychologists. There's others who will be part of the team to enable a wraparound support for these families, but also to travel the country, upskilling other teams who also play a really important role in providing palliative care in our communities. And so this is not just about location or where the teams are based, but actually the fact they will be travelling, they will be on the road, they'll be going across the country to ensure that that care is consistent for all New Zealanders.
Given the health workforce challenges in New Zealand and the fact that this is a very specialised area,
yes,
does New Zealand have the workforce at the moment that can upskill into those
yeah,
areas?
We're very lucky to have Amanda, and so she's amazing, and she's got a wonderful team at Reiko Tuku who provide, I think, incredible expertise. So part of this announcement is actually continuing the work that they do, because we need to retain Amanda's expertise and her team's experiences so that we can build that into the model that Health New Zealand will be establishing. But also, a big part of this announcement is the additional there'll be a training position each year for an additional specialist. So yes, we may have to recruit offshore in terms of the initial setup of these services, but we are committed to establishing a locally grown workforce to provide this care for patients, and that's why having a committed training position each year is so important for the future of this service in New Zealand, because we want New Zealand-based clinicians providing that care to New Zealanders up and down our country.
Just for my own clarity, this money that you've announced today, is that from the operating allowance?
No, it's new money. It's on top of the operating allowance. Yep.
Minister, you might add maybe you want to speak to this as well. Can you give us an idea of the level of difficulty families encounter to access this kind of care in the current state or current
Yeah, I'll let you speak to that.
Yep. Well, I think you're very lucky if you live in Auckland or Wellington now to get the service that you require. But Aikotuku travels all around the country. This week I was in Hawke's Bay, we're flying to Taranaki, Whangarei. So we're going all over the place, but actually it shouldn't rely on goodwill. This should actually be just an essential part of the health service that's normal to have a paediatric palliative care across the whole of New Zealand. And to your question, when you asked about why the money is being spent, this is actually an essential service in most of the OECD countries across the world, and we're actually an outlier not having the service. So now it's actually getting us to the point where we can match other places around the world.
In an ideal world, would you want teams based in each region?
I think that we can work out the implementation plan once the funding comes through, and the way that I see it working is that the local teams are integral in actually providing care to all of these families, and this is what's happening now. We go to them, we work with the local teams, work with the community, and the community is actually the people providing the care, and we're the specialists in the background to be able to support them, and that actually works really well. The families that we're caring for out of the region feel very supported, and they know that they've got access to us 24/7.
So is there not the need for more people based on the ground, closer or in more areas? Because obviously travel takes time, it takes resources. If you've got one team in South Island's a big place.
Yeah, and we partner with everyone that we in every single region, because it's a rare event to have a child at end of life, and you might get one child in Invercargill every 6 to 10 years. You would never set up a team that's in the lower South Island to be able to care for them. So actually flying in and out, empowering the community to be able to care for their own children as they see fit is really a wonderful way of practicing. And we know this model works. It's a model that's done in Victoria. When I worked there, I travelled to Tasmania from inner city Melbourne, and actually all of those children feel really well supported. Yeah.
You said this was the first time you looked out and listened to. What have the barriers been? Why do you think it's taken so long to listen?
I think that the first barrier is probably that everyone just assumes that if your child is needing palliative care, you'll get the support that you need. People assume that in New Zealand this will be accessible to you, and people don't think about it, to be honest. Often in New Zealand we won't want to think about children dying, but actually it is a reality, and when they do start dying, they do it behind closed doors. People don't see them. Sometimes they feel invisible, and then they die quietly. Their parents go about their business bereaved, and it's something that we don't yell and scream about. So I guess one of the things that we've done is actually brought the parents into the limelight, let them share their stories, so actually New Zealanders can start really understanding what these families are going through. Because actually it's not about me wanting to do my job, it's actually about what is the right thing to do for children and their families.
That's right.
Minister, from your perspective, what have been the barriers to, why haven't we had this sort of a system earlier?
Well, I think when it, as I said, I wasn't aware there wasn't one when I became the minister, and so from my perspective, I met with Amanda early on. She's been an amazing advocate for these families. She's not only cared for these families, but she's been an amazing advocate to actually put the case forward as to why there needs to be investment. She took me to meet with some of the families middle of last year, and that was a real eye-opener to me. And I guess where there are gaps, we need to make sure there's a country we fill them, and that's what we continue to do. It's why we continue to invest in healthcare. But where there's particular needs like this, we have to do this, and I'm very grateful that we've been able to do it.
Around 3,000 children may need care. How will you ensure that funding that you're allocating will care for all of these children?
Yeah, so the funding is designed to set up these specialist teams. They will work alongside primary care, they will work alongside hospice, they will work alongside other teams within the community. And so it's not just about the team of specialists, but it's also about the work they're going to do to upskill our health system to be able to care for our most vulnerable children and their families. So this is not just an investment in a workforce, it's an investment in actually the wider health system. And by having these specialists like Amanda in New Zealand able to do that, those families will be far better cared for and supported, and as she said, receiving a standard of care which is common in most other countries. So it's a need, and we're meeting it.
Is this the first year that you submitted a budget bid for this sort of initiative, or was there one last year that you through?
So this was submitted as part of this year's budget, and as you know, I became the minister only moments before the last year's budget, but it's been a priority for me.
Another issue that's popular for this budget, I suppose, is medicines.
Yes.
Indication of whether that budget might be expanded.
Oh look, you'll have to wait until budget day. Very good. One last question.
Your campaign chair, Chris Hipkins has done a speech this morning in Auckland. He's saying that not enough is being done to power up the city, that the regional deal is not enough, unemployment is high in Auckland. What's the government doing to address that, and will National have any?
Yeah, I mean, it's the same. It's the same Chris Hipkins who locked Auckland down for the longest ever, let ram raids rip across our city, and ultimately has left a big mess that we're having to clean up. And so we're not going to take lectures from Chris Hipkins. Thank you very much. Absolutely, but we're not going to take lectures from Chris Hipkins. Thank you very much. Thank you. Thank you so much, Amanda.
Thank you. Thank you, Brian.